In the words of author J.A. Houck, are you hot and bothered? As many as 50% of menopausal women experience annoying hot flashes. Additional symptoms may include sleep disturbances, mood changes, and weight gain, just to name a few. Regardless of symptoms, all women should understand the impact menopause has on their overall health. Research suggests that menopausal women are at increased risk of developing serious health complications because of a significant decline in female hormones and limited treatment options that have varying benefits and risks. In today's presentation, we will cover two main points. The first main point will focus on a decline in female hormones during menopause and how it can contribute to significant health conditions and cause symptoms that can impact a woman's quality of life. The second main point will cover treatment options for menopausal symptoms and their varying benefits and risks. Now for our first main point, let's talk a little more about menopause and how it affects the female body system. As estrogen and progesterone decrease slowly and progressively, this marks a significant change in a woman's life. According to Weber in 2007, symptoms usually begin between 45 and 55 years of age. An irregular menstrual cycle marks the beginning of menopause and is referred to as perimenopause. Once menses completely stop, then women are referred to as being menopausal. Symptoms may vary in women, but in addition to the hot flashes previously mentioned, they most commonly experience night sweats, mood swings, loss of concentration, fatigue, and a decline in libido. Now let's talk about some of the health problems that are common in menopausal women. We start with the cardiovascular system, which actually impacts the entire circulatory system. Women of menopausal age are at higher risk for developing heart-related problems due to one or more common health risks, such as elevated cholesterol, hypertension, diabetes, and obesity. Hypertension is common in postmenopausal women, and 80% greater than 70 years of age will develop hypertension. Most women greater than 20 years of age will develop high levels of cholesterol in their blood. Many women are unaware that heart disease is the leading cause of death in women. Another serious concern is osteoporosis. Estrogen plays an important role in bone development and maintenance of calcium levels in the blood. Menopausal women immediately begin losing bone density at menopause at its onset, and they are at risk for possible fracture. According to Weber in 2007, it is estimated that 40% of postmenopausal women will experience a fracture. Now, as reported by Nova in 2013, a very significant health risk during menopause is cancer, which is linked to organs dependent on estrogen, such as the breasts, endometrium, and ovaries. Education, health screenings, early detection, and treatment contribute to improved outcomes in menopausal women. Lastly, a condition that often is overlooked is depression. Although not directly linked with a decline in hormone levels during menopause, women suffer varying degrees of depression due to loss of fertility, changing moods, memory, and cognitive changes. This can result in significant loss in quality of life, according to Curry in 2006. Now, for the second main point of this presentation, let's review treatment options for menopausal symptoms, which are limited and have varying benefits and risks. Let's begin with the FDA-approved prescription hormone therapy treatment. Estrogen therapy was first introduced to women in the 1930s. The number of women using therapies such as estrogen replacement therapy grew over the next 4 decades. But as medical studies began to show a link to endometrial cancer, there was a decline in its use. Then in 1970, progestin was added to the regimen. And with new studies reporting a decrease in these risks, more women began using this therapy. In the 1998 HERS report, it was revealed that women using hormone replacement therapy were at increased risks for blood clots and gallbladder disease. Additionally, in the 2002 World Health Institute report, WHI, they showed an increase in ovarian cancer as well as stroke, heart disease, and possibly Alzheimer's. According to the National Center for Biotechnology Information, NCBI, in 2003, oral hormone replacement therapy is linked to an increased inflammation in blood vessels and elevated liver proteins, which can contribute to those health risks. These reports failed to show that women experienced an improvement in quality of life. So, moving on, perhaps more controversial is bioidentical hormone replacement therapy, referred to as BHRT. This treatment is marketed to reduce menopausal symptoms, decrease health risks, and promote weight loss in women. Although BHRT requires a prescription, the FDA has not approved its use. And according to a 2008 FDA report, there is no scientific evidence to support these claims. Now, other treatment options for menopausal women are made without a prescription and over the counter. Black cohosh is one supplement on the market that has been formally studied, but results demonstrated conflicting reports of its effectiveness. According to U.S. Department of Health and Human Services in 2008, long-term use of black cohosh has side effects such as headache, stomach upset, and liver involvement. Lastly, according to NOVA in 2013, maintaining a healthy BMI and regular exercise positively benefits all women during menopause. Research states that menopausal women are at increased risk of developing serious health complications because of a significant decline in female hormones and limited treatment options that have varying benefits and risks. In summary, the two main points discussed in this presentation are the decline in hormones in postmenopausal women significantly impact health and quality of life, and treatment options that are limited with varying benefits and risks. In closing, women should be educated about menopause and understand the potential risk for serious health conditions. Women experiencing menopause should fully investigate treatment options for their symptoms. They should discuss their benefits and risks under the care of their medical practitioner. Thank you.